This is Abia COVID-19 update.
Abia COVID-19 update.
Well, to help lessen the spread of the new coronavirus and the COVID-19, that's the disease it causes, there are important steps that can help protect you, your family, and others. It is important to understand that the new coronavirus spreads mainly from person to person, and if an infected person coughs or sneezes, their droplets can infect people nearby. That's why it's important to avoid close contact with others. Some measures you can take to avoid close contact with others include: stay at home as much as possible and reduce visitors. Practice social and physical distancing. Stay at least 2 meters away from others in public places. Call friends and family or visit by video and FaceTime on your WhatsApp, on Twitter, on Facebook, on various social media platforms. It is also important that you wear your face mask in the public. The new coronavirus can survive for hours or even days on some surfaces. Touching a contaminated surface and then touching your face is one of the ways to become infected. So with that in mind, wash your hands with soap and water frequently and thoroughly for at least 20 seconds, especially after being in public places and touching door handles. After using the bathroom, before preparing food, if soap and water is not available, it is very important you use your hand sanitizer for with at least 60% alcohol, and avoid touching your eyes, your nose or mouth, especially with unwashed hands. So if you cough or sneeze, do so with your bend of your elbow, rather. It is very important. If you use a tissue, throw it away immediately. This is Abia State COVID-19 update. My name is Michael Oni. On this program, we highlight daily report of the Interministerial Committee on the Control of the COVID-19, as well as Abia State Governor Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. It is running simultaneously on several radio stations in the state, live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. Let's do the figures as of 7:40 today, Thursday, the 14th day in the month of May 2020. Globally, we have 4,430,242 infections of coronavirus, which have been recorded, leading to the deaths of 298,183 people. 1,661,536 people have recovered, and most cases have been reported in United States, in Spain, in Russia, United Kingdom, and Italy, with the United States recording just this week on Tuesday, recording the most corona deaths in a single day, with more than 1,800 fatalities, bringing the total number of the deaths in that country to nearly 85,000. What a not a good one then. But Nigeria yesterday recorded 184 new cases of COVID-19. 6 people also died from the virus. And according to the Nigeria Center for Disease Control, the total tally of the infected people in the country rose to 4,971. Nigeria has so far tested 29,408 persons since the beginning of the pandemic in the country. And of course, of that number, 3,737 cases are still active. Now, welcome to the program. Once again, it is Abia State COVID-19 update, live on several radio stations in the state. Now, this morning on the program, we will be taking a look at the legislative support for COVID-19 battle in Abia State, as we have the member representing Umuahia South State constituency and member of the subcommittee on palliatives of the Interministerial Committee on COVID-19 set up by Abia State government. Honorable Jerry Uzosike is very much in the studio. Good morning to you, Honorable.
Good morning.
Good to have you join us this morning on the program.
Thank you.
Sir, can you update us on the efforts of your subcommittee in assisting the people with palliatives as promised by the governor of the state?
Yeah, the committee have been working very seriously in making sure that food get to the those in need. You remember that the first strategic people we decided to visit with food were the indigent in the society, wherein we chose to give food to the indigents. The committee, through the governor, decided to use churches. It was also strategic so that it will not be it will be anti-politics. It will be apolitical, so that no political party will say food was only given to politicians.
Okay.
That was why the committee, through the help of the governor, decided and used the churches to share this food, because whether you have any political party, you attend one church or the other. We did the first phase, we did the second phase, wherein we captured some other churches that weren't captured in the first phase. And there were also people who are the poor of the poor. The committee, also through the governor, decided to choose about 200 and something per local government, wherein we set up a committee was set up to visit them in their homes and give to them. The committee passed through local government by local government.
Okay.
You make nominations, they go there and see whether those people qualify to inherit that. And immediately, that one is still ongoing, and at the state level. And you also know that state is all about local government and then villages.
Okay.
Also, from tomorrow, you also are aware there's a news, an announcement going on that the union leaders in our universities will be receiving their own palliatives this week. We've announced all
meant for the students.
Meant for the students who are trapped. Some of the students who were in schools around our state. When the lockdown started, some took it. Some felt it was going to be for 1 week. Some felt 2 weeks. They never knew that it was going to be for months. So both of those students came from Lagos, from other states other than Abia. So they've been trapped down. Some of them within the university environs, and they've been crying that look, they need support. And the state government, through the efforts of Dr. Ibazo and then the committee on food security, have also worked out that look, let the student union government come from today, tomorrow, and receive the palliatives for those who are in need, those students. So these things are ongoing. As per palliatives, I think the state government is doing a lot of work, but you also know that no amount of palliatives will be enough to feed the public. No amount.
So let's take it in batches now. You started with some number of churches and also the Muslim community.
Yeah.
First batch, then some number of churches were added. Then later on, you went down to the local government level.
That's correct.
And the students will be receiving theirs today.
Yeah, from today tomorrow.
But some churches are still asking, we are not involved. We've not been a partaker of this palliative being distributed. How did you select those churches that benefited already from these palliatives? Yes,
the committee looked at churches that have branches. In as much as there are structures, there are already established structures, government structures. Those government structures are structures based on wards, political wards.
Okay.
Autonomous. Remember also that we've also handled through autonomous communities. And there are levels of government. There is the federal level, there is the state level, even in the local government level. Even in those levels, there are also other levels of government. For example, senatorial districts, federal house districts, and House of Assembly also constituencies. In the heads of these governments or the heads of these positions have also done at their own level. Now, to answer your question, how we chose the churches, we looked at there are churches we know that you can capture Abia State through those churches. There are some first-class churches, not as per spirituality, but as per population. We didn't choose them because they are more spiritual than others. But we feel that there is a church you must see in every part of the state, no matter how remote the place may be. For example, the Catholic Church, the Anglican Church, Methodist Church, some of those churches, the SDA, the Kwaibo, all those churches, you are very sure that there is no local government, there is no ward, you will not see at least one. So that was how we chose the first set of churches. And then the second set, we now said, okay, there are also some big churches, but they are what we call family churches.
Okay.
They can only be found maybe in one place, in one city. For example, if you go to Mission Hill here, you have one or two churches that they are big, but they are just one family church. You can't get it in Abia.
They have only an headquarter, probably one branch in Abia State.
In Abia. If they have any other branch, it could be outside the state. So those churches were captured in the second phase. And also, some of the churches that weren't captured by all these things, their members we are captured also through the palliatives given by the Senate of those constituencies, by some of us, by all of us in the House of Assembly, and the Federal House members. You may recall that some churches, I did my own palliative through the local government. I passed through the wards and the villages.
That's your personal palliative? My
personal palliatives. I did it. I kickstarted it in my local government. I used the already established government structures. When the Speaker of the 7th Assembly in Jinioji wanted to do his own, he used the churches. What he did was to sit down and look at those churches that weren't captured by the state government because they were maybe one family church or smaller churches. So he now picked all of them that he could reach, and then pass his own palliative. Then the Senate of the Federal Republic now said, okay, since the state government is working through the churches, the Speaker to the churches, some House of Assembly members, that he was going to work through autonomous communities. So he now sent, Moya South, we have about 47, 48 autonomous communities. So the senator sent his own. They were now distributed through autonomous communities. So the choice of those churches weren't based on any level of dignity, but in population and then in reach.
All right, if you've just joined us, this is Abia State COVID-19 update. It's running on several radio stations in the state, in Abia State, God's own state. And we've been speaking to the Honorable member representing Umuahia South State constituency and the member of the subcommittee on palliatives of the Interministerial Committee on COVID-19 set up by Abia State government, Honorable Jerry Uzosike. We'll take a breather now. When we return, I would want the honorable member to break it down in specifics what the Abia State House of Assembly has done to support the efforts of the government, of the governor, Okezie Ikpeazu, when we return. It is Abia State COVID-19 update.
This is Abia COVID-19 update.
Abia COVID-19 update.
Well, thank you very much for staying tuned. It is still Abia State COVID-19 update live on several radio stations. I'm talking about BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and also Real FM. Now, Honorable Jerry Uzosike is still very much in the studio, the member representing Umuahia South State constituency and the member of the subcommittee on palliatives of the Interministerial Committee on COVID-19 set up by the Abia State government. Now, Honorable, Abia State government seems to be having problem checkmating the porosity of the border points. Is there no way the House can come with legislation to this effect?
Yeah, before I tell you the legislative framework we are putting in place for the border problem, permit me to say that the Food Security Committee, we've also want to inform the churches that the palliative distribution to the churches is still ongoing. It has not stopped. So, because I know our chairman, you may recall that the chairman of that committee is Chief John Oki Kalu. He's working very hard and generating the names of those other churches that weren't captured. So we've been holding meetings and then giving the details of those churches. And I can assure you that the churches that weren't captured in the first and second phase of church distribution will be captured. Now, to your question, we've watched. There's something we say in law that the court is also a Nigerian.
Okay.
The House of Assembly, we are also Nigerians. We are also Abians. We've watched with high level of dismay the level of breach of security occasioned by by some truck drivers, lorry drivers, flooding in people, even when there is a lockdown. For us, I think yesterday also, we read in the news about 40 people.
Over 40 youths from the
youths
northern
from
part
the
of
north.
the country stowed away
Yes.
in a truck.
And we are worried. We in the House of Assembly, we are worried. And that is why, most likely by next week, there will be skeletal actions will start at the House of Assembly.
Okay.
It's important because the Speaker of the House has informed us that we are moving back to the House to begin to provide the enabling legislative framework needed. Now, how are these guys beating the security from the north to this place? I saw pictures of the video of those people concerned. They are not Almajiris as we quote. Because Almajiris, I was told that they have age of from 5 to 12 years or 10. These are adults. Why are they now struggling to move into southeast Abia, Enugu, and Ebonyi, and most of those states? Now there is a federal lockdown, not only a state lockdown. There is a ban in interstate movement. But they are forcing themselves out, and even coming from a high-risk state. So we are worried, and we are going to move in the House of Assembly. You should also know that whatever the governor is doing as per spending funds, he has what we call in law approval in principle.
Okay.
AIP. We are in a war situation, and the enemy is the virus. So the governor has an approval in principle from the House of Assembly, but we're going to move in now to now look at what has been done from next week. The committee in health, the committee in the House of Assembly Committee on Health, we've already held 2-3 meetings through Zoom, facilities of the internet. But this week we'll be going on ground in the House of Assembly. We'll be looking at what had been done,
okay,
and then the way forward, and then the needs of the state as it concerns funds, so that we will be appropriating. We'll be giving a Lego back into few things the governor is doing and the things he may want to do.
Are we going to be seeing a review of the 2020 budget, maybe when you resume?
Definitely, there's going to be a review. Let me tell you, when we were handling the budget, for example, of Homeland Security, Security Ministry,
yes,
we never envisaged that they were going to be overstretched by this level of locking of borders. If you go to 2020 budget, we didn't appropriate for COVID-19. We didn't appropriate we didn't make budgetary provision for these unforeseen circumstances, and it's of high magnitude. So that can only inform you that there's going to be a review. It could be upward, it could be downward, but we're also going to do approve some vehement. That is, if there were approvals that were given for some ministries or agencies, and we see that those approvals are no longer as important as the ones
with the
situation on ground,
okay,
we may be approving officially for the executive to do a vehement, to move funds appropriated for one thing to the other. We should be given legislative backing for some of those things. So there's definitely going to be a review of the budget. It could be upward, it could be downward, based on the reality on ground.
All right, if you want to be part of the conversation this morning, the third edition of the program Abia State COVID-19 Update, you can be part of the conversation by calling the lines 0808 182 6949 or 0811 605 2949. You can also drop messages on 0906 510 8289. It is Abia State COVID-19 updates. Good morning to you.
Good morning, Mr. Michael.
You're welcome.
Good morning, the honorable member.
Good morning, sir.
My name is Mr. Madu Edward, aka Editor-in-Chief / Iron Pillar. This morning I call from the good club and Nikki Table. Yeah, I want to thank you, the honorable member, and also thank the governor of Abia State for his effort in a way to make sure that Abia is safe. Because the major thing is to be protected and be alive. But my own problem there is that the security men There are some people in Abia State that we are saying that they are not being paying. Most of the vigilante of all the security network, that they are not being paying. Those that have already been given some money, they don't give them until what they again. And that is making them to be annoyed. Like I was unfortunately to ask, is it the only one people are taking bribe or what?
All right, quickly wrap up your thoughts, Mr. Madu Edward.
The police are paying well, but they are not paying well. Please try to pay them so that they can help the government to do what is needed. Thank you.
All right, Honorable Member will respond to that.
Yes, he talked about remuneration of vigilante. I can assure you that it's really a very difficult time for the state now. Very difficult time, because the security architecture, both federal and state, as it concerns the vigilante, is overstretched. I live in a border community. In my community, in my clan called Umawara, we have two serious borders. The one in Ikelobizi and the one in Omuawa. As we speak, there are vigilantes in all those areas. They've never been such security in those places in the last 40 years. So, the security provision, if you want to secure our borders, if you want to spend the required resources to secure our borders of the state 100%, I can assure you that the whole money, the entire capital budget of the state will not be enough. So I can only encourage the vigilante men to please be a little bit patient with the governor. He would have wished to pay them 100%, whatever their requirement is. And that is why we are going back to House of Assembly. We'll be resuming very soon to be able to look at all these things and make funds available.
Okay.
And give the governor any instrument he may require.
Okay. Hello, good morning to you.
Hello, good morning.
You're welcome. What's your name?
Yes, my name is Martin from Ikwano Matoto, not the other Matoto that is calling from Idere. This is Matoto from Ikwano, not that one.
What's your question? Go on with your question.
So now my take, I want to really congratulate the governor of Governor Keze Pazo for his really for his efforts given to Abians both in the state and outside the state. I really want to commend our honorable member John Oki Kalo for his kind gesture to protect the good people of Abia State. Let me be frankly speaking, truly, is that John Oki Kalo has been doing a lot of job, and we should put more effort on our security based on the homeland security. We should put more trust on them because they are the ones really doing the real job in Abia State, empowered by the governor of Abia State.
All right, quickly wrap up your thoughts so that we can
I am grateful to the governor. He is a lovely governor and he is a man of the people, and we love him. We love him. Equal people love him so much for his good gesture and kindness.
Thank you for your contribution. Hello, good morning. We lost that on the SMS line. We've got messages also. Let's see what we've got here. Good morning, Mike and Honorable Jerry. The governor and his team are trying, and keep it up. Our Church of Christ, has not been remembered. We have over 1,000 branches in this Abia State. In Umuahia town, we have about 10 branches. Thanks, Uncle J from Umuahia. The palliatives the state government wants to give the Abia undergraduates tomorrow. Now the students are at home is not ideal. How will the student get the palliatives? Let them get to the students. Verily from Umuahia. We want
the chairman of the. I can tell you that the chairman of the committee of food security, which is Chief John Oki Kalo, is working very great. Also in informing us in the state and then in the security committee. The people, the students that will be giving the palliatives is not the students at home. I told you that the student union governments in some of those schools, they've informed us, and we verily believe them, that there are students that have been locked up.
Okay.
That are cut off, who felt that the lockdown was going to take 1 week, and some of them didn't travel. So we can't abandon them to begin to indulge in prostitution, in armed robbery, in order to feed themselves. So the committee, through the able chairman John Oki and then our governor, they found it fit that look, we should do something so that these young girls and boys who are very active, we have something to keep them on wherever they are. We're not giving it to all the students. No. Some of them are already in their homes receiving the palliatives that we are sending to their parents. This is specifically for those within the school community who are active, who are hungry, cut away from their family.
Okay, Honorable Jerry Uzosike, we want to really appreciate you, your time this morning on the program Abia State COVID-19 update. He's the member representing Umuahia South State constituency and the member of the subcommittee on palliatives of the Interministerial Committee on COVID-19 set up by the governor of the state, Dr. Okeze Victor Ipazo. Thank you very much, Honorable Jerry Uzosike, for being part of the program this morning.
Thank you so much, and please keep safe, Abians. Keep safe and keep very safe. Obey all the World Health Organization and Abia State Ministry of Health protocols on COVID-19. You'll be safe.
All right, thank you very much. We will be back tomorrow, which will be the last edition for the week. Many thanks to the partner stations, Flow FM, BCA FM, Vision Africa Radio, Buzz FM, and Real FM. My name is Michael Oni. Stay safe and take responsibility.